If you or anybody you know is doing this, stop doing it. It will ruin your teeth and you can end up losing your front teeth. Tongue or lip piercing can cause a significant damage on tooth structures as well as the surrounding tissues of the teeth, the periodontium. The gum, the bone, the ligament can be damaged as a result of a constant and chronic hammering over those structures from that tongue piercing. Tongue and lip piercing became relatively popular during the 90s. There's been a resurgence and now we're seeing a number of young adults, aged 16 through 30, that are starting to use again this type of cultural practices. It is relatively more common in females than males, but the prevalence of oral piercings has been on the uprise again. I have seen throughout the last 27 plus years a number of young adults wearing this type of tongue and lip piercings, and I have seen the damage that they can cause on oral structures, not only the teeth but the surrounding tissues of the teeth, the periodontium, the gums, the bone and the ligament. The damage created to the periodontium can be significant, irreversible and very difficult to treat. So tongue and lip piercing are moderately common practices among young adults ages 16 through 30. And although there was some decline in this type of practices, recently we have seen an upsurge of the use of lip and tongue piercing, which can lead to significant damage to the teeth and surrounding structures of the teeth. So think twice before having one of these piercings. The case that I'm presenting here was a 25-year-old female that had been wearing this tongue piercing for over a year. After examining the patient, we can see a significant amount of attachment loss or bone loss around the lingual aspect of those two central incisors, with radiographic and clinical bone loss. If this patient continues to wear this tongue piercing, she will end up losing those two central incisors. At this stage, she has lost over 80% of the bony support on the lingual aspect of those two central incisors, and it would be very difficult to treat and correct the existing severe gum recession that she presents on the lingual aspect of those two teeth. So if you or anybody you know is considering to have a tongue piercing or a lip piercing, tongue piercings are worse, by the way. I see more damage when you have them. Think twice before you have it and consider that you may end up losing two front teeth or have severe irreversible damage to the surrounding structures of those teeth. The gums, the bone, the ligament can be severely damaged as a result of that tongue piercing hammering on a regular basis to the back of those two front teeth. And that can be actually very difficult to treat. My recommendation would be to stay away from it, and if you already have one, take it out as soon as possible and see a periodontist for further advice. They may be able to correct the issue and prevent further attachment loss, further bone loss around those two front teeth. There is also scientific evidence published on this regard, showing the damage, periodontal damage, that piercings can cause on the periodontium, the gums, the surrounding tissues of the teeth, and the teeth, the tooth structure itself can be caused as a result of a long-term use of tongue or lip piercing. If you have any questions or want some advice on prevention, just comment the word piercing. We mentioned in earlier videos the number one cause of gum recession. As I mentioned earlier, the number one cause of gum recession is trauma or trauma-induced gingival recession that usually comes from incorrect or aggressive, ineffective toothbrushing, not properly done. Like I said earlier, there are a number of trauma-induced factors that can lead to gum recession, and definitely piercing is one of them. The amount and the severity of attachment loss and bone loss around teeth that are close to a piercing area is 2 to 3 times greater than a trauma that a toothbrush can cause from incorrect toothbrushing. So consider that. The trauma induced by an oral piercing, like the tongue piercing, can be significantly greater and faster than regular or incorrect toothbrushing, especially if the patient has a thin biotype, thin tissue that is more prone, more fragile to a recession. And like we said earlier, all those front anterior teeth already have a fragile, thin foundation, thinner tissue, thinner gum tissue, and thinner bone that can be compromised as a result of a constant hammering with a piercing over the tooth structure.